In today's lecture, we are going to study landmarks, planes, and patient positioning that are used in skull radiography. All radiography of the skull is undertaken with reference to a series of palpable landmarks and recognized lines or planes of the skull. Proper radiographic positioning of the skull depends on a number of lines and planes as well as palpable or visible landmarks. Some of the important landmarks of the skull are outer canthus of eye, inferior orbital margin or point, nasion, glabella, vortex, external occipital protuberance, which is also known as inoin, external auditory meatus. What is outer canthus of eye? It is the point where the upper and lower eyelids meet laterally. Next, infraorbital margin, the inferior rim of the orbit, with the point being located at its lowest point. Nasion, the articulation between the nasal and frontal bone. Glabella, a bony prominence found on the frontal bone immediately superior to the nasion. Vortex, the highest point of the skull in median sagittal plane. External occipital protuberance, a bony prominence found on the occipital bone usually coincident with the sagittal plane. External auditory meatus, the opening within the ear that leads into the external auditory canal. Some of the anterior and lateral landmarks are shown in the image below. Some of the planes of the skull are median sagittal plane, coronal plane, anthropological plane, and auricular plane. Median sagittal plane is the plane that divides the skull into equal right and left halves. Coronal planes, these are at right angles to median sagittal plane and divide the head into anterior and posterior parts. Anthropological plane, a horizontal plane containing the two anthropological baselines and the infraorbital line. It is an example of axial plane. Auricular plane, perpendicular to the anthropological plane that passes to the center of two external auditory meatuses. It is an example of coronal plane. The median, sagittal, anthropological, and coronal plane are mutually at right angles to each other. There are some important lines that are used in skull radiography. These lines are inter-pupillary line, infra-orbital line, anthropological baseline, orbitomeatal or radiographic baseline, auricular vertical line. Lines of the skull are inter-orbital line, that is the line that joins the center of two orbits. Infraorbital line joins the two infraorbital points. Anthropological baseline that passes from infraorbital points to upper border of external auditory meatus. Orbitomeatal or radiographic baseline that extends from the outer canthus of eye to center of the external auditory meatus. Anthropological baseline is also known as Frankfurter line. Patient positioning is very important in order to avoid artifacts. Whether the radiographer elects to perform the examination with the patient in the recumbent or upright position depends upon four variables. These are the equipment available, the age and condition of the patient, the preference of the radiographer or radiologist, whether upright images would increase diagnostic values, such as showing air fluid levels in paranasal sinuses. Uncomfortable body positions result in rotation or other motion that is responsible for majority of repeat examination, and these may degrade the quality of radiograph. All skull positions are based on three factors that are rotation, tilt, and flexion or extension. The three important types of skull position change are rotation, flexion or extension, or tilt. Rotation is also known as no position. Flexion or extension is also called yes position. Tilt may also be called as maybe position. That is it for today's lecture. Thank you very much for listening this lecture.